All right, here we go. So we've got a budgetary piece here in Washington State. $20 million in long-term care money for Washington immigrants is to cover fewer than 200 people. When they say fewer than 200, they mean 173. Originally, they were thinking, this should be about 1,200 people worth of coverage. 20 million, 173. And that's immigrants. We're not even talking about tax-paying residents in Washington State who don't have health coverage. 20 million for immigrants. What's the dealio? Let's get into it. Here we go. So we are reading from KUOW, which is an NPR network. This was originally written by Jake Goldstein from Washington State Standard. They kind of cover Washington State politics type stuff. So a number of you sent me this article, so we're going to read it. Washington State lawmakers this year approved spending nearly $20 million to ensure immigrants here could retain long-term care insurance coverage that they're set to lose under federal law. Legislators and advocates thought that money would put the state on a path to cover nearly 1,200 lawfully present non-citizens. It turns out that it'll only be enough for 173. So in the big blue states, they've taken on just loads and loads and loads of immigrants. And the immigrants oftentimes, they don't have health care. And it's one of those, we go over the litany of things that taxpayers have to cover that folks don't really think about. Hey, where's my taxpayer dollars going? And so when you've got the liberal heart, just, the poor people. There's plenty of Washington State residents that don't have long-term care either. They don't have health care. And they're working, they're paying taxes, and you know what I mean? We virtue signal with our financing where things are going to go. And you can't take care of everybody all the time. You just can't. And that's where the whole bleeding heart liberal thing just gets you into financial trouble, because 20 million here, 20 million there, 300,000 for the trans community because there's a state of emergency in Seattle. We're literally voting on that right now. And so the people on the right are going to go, well, it's so trans individuals can get, elective sex change surgery. Well, it's not for that. I mean, they're saying it's not for that. But when you hand over $300,000 because there's an emergency, because all these thousands of trans individuals are moving from Texas and they're going to Seattle, you put $300,000 in the hands of an NGO, you don't really know where it goes. It could be used on anything. 20 million here, long-term health care. All right. It's according to Adam Glickman, 173 for 20 million. Treasurer for Service Employees International Union, 775. The unions are involved in everything. It's a Caregivers union, which pushed hard for the funding. I bet they did, right? I bet they did. A union pushing for funding for immigrants. Weird. Other states are not doing that. Other states are solvent. Other states don't have massive budgets, deficits that they're coming up against all the time. Washington State does. Oregon does. California does. Because they're fiscally irresponsible. Hey, you don't have money for that. And the money you do have, it's always so wildly overestimated what they're going to get out of it. It doesn't make any sense, right? All these programs. And it's all these programs that you put together and you're like, good Lord, that's where the money's going. It's like what Doge was doing at the beginning of the Trump's administration, cutting out ridiculous funding for stuff we don't need, that we can't afford. Revelation based on changing assumptions from federal guidance was disappointing and frustrating, Glickman said. It puts individuals and families in really difficult situations, and really, in some cases, dangerous and unhealthy situations. Should they have had the funding in the first place? That's the question I ask. Right? I mean, so much of what people view as being taken away, should it have been there in the first place? Is every Washington State resident that was born, raised here legally, do they have their healthcare situation squared away? Because if they don't, should we be spending money on this? That is the question. The original goal of wider coverage would cost tens of millions more dollars each year. And you get into a situation where you're like, okay, how many hundreds of millions are we going to spend? Well, we got to keep spending because we're not covering. It's like the housing first thing, where, if you just build a bunch of housing, they'll live in it and they'll get on track with their lives. They'll get sober and, they'll get a job and they'll retrain themselves and they'll get married and they'll have children and live happily ever after with the white picket fence. No, they just continue doing drugs in whatever housing you build for them. Pretty basic, right? Shouldn't say that for everybody, but that is more the story than the exception. Lawmakers assumed the $20 million would cover 300 people in the current fiscal year. All right, so we're up to 300 now, which ends June 30th, 2027, before ramping up to the full, nearly 1,200, with closer to 100 million per year. We're going to do a hundy. Going to do a cool hundy for 1,200 people. Yeah, no, we're not. In the next 2-year budget starting July 2027. But the money still doesn't even stretch that far. Where does it go? Where does it go? NGO salaries. That's where it goes. Department of Social and Health Services Secretary Angela Ramirez said last week her agency would continue to look under every rock to see what we can do. So we have so many ridiculous programs here in the state of Washington, not unlike New York, where Kathy Hochul, governor, basically said, we need all the wealthy people to come back from Florida to fund our generous welfare programs. Literally came right out and said, we need you guys to come back because without your tax dollars, we can't fund all this stuff. Hey, who knew? Yeah, you're going to have to make some cuts. Cuts are being made here to programs that probably shouldn't have been done in the first place. So there's that. Continue to look under every rock to see what we can do. All right, well, you're probably going to be looking for a long time and not going to find much because the money's scarce, right? And the federal government is making cuts. They're cutting back on stuff that they view as not necessary. Everybody flips out and goes, we needed that. Well, that's how you get a bloated budget. That's how you just have money spent on just all kinds of stuff that, number one, you couldn't afford, that you shouldn't afford, and moving forward, shouldn't be in the budget. But make no mistake, when this cut hits, it's going to be harmful. Big, beautiful bill congressional Republicans passed last year cuts Medicaid coverage for most non-citizens. All right? Yeah, that's pretty normal. That's pretty normal because you got a lot of citizens here who don't have health care coverage. So there's that. State officials project nearly 14,000 in Washington will lose coverage on the insurance program for low-income residents starting October 1st. So when they come, when Greg Abbott started just sending busload after busload to Chicago, Denver, California, and they're like, oh yeah. I mean, we'll take your needy, we'll take your unwanted. Just send them to us, and then let's go. Brandon Johnson started penciling the numbers, and he's like, wait a minute, stop. We don't have money for that. The light bulb goes off. Oh my gosh, these people are going to need to have health coverage. They're going to have food, clothing. They're going to have training. Get them on board. They're going to have. And Greg Abbott knew that. Greg Abbott has a massive budget surplus, not a deficit. That's how you get there. Fiscal responsibility. Sometimes it's hardcore. Hey, yeah, we don't have money for that. We're not funding that. Close 1,500 non-citizens receiving long-term care services. Notices of the change went out to these enrollees last month. They'll get termination notices in late August. Federal law cuts Medicaid coverage for refugees and asylees and other lawfully present immigrants, including people who fled the war in Ukraine, for example. It maintains eligibility for lawful permanent residents and other select categories of migrants. You don't have enough money to cover everybody, and people are going to lose their funding, and it's going to be terrible. That is just the way the world works. You've only got money for so much. And these big blue cities, that's why they are continually scrambling, because they've got these big bloated budgets that they couldn't afford in the first place. Now they're going to blame it on the federal government. Oh, the big, beautiful bill. I love that name. It's so funny. It's big, it's beautiful, it's Bill. This will leave immigrants with disabilities without caretaking help with basic tasks like getting out of bed, taking medication, and bathing. All right, that's terrible. Nobody wants to see that kind of thing go away. But we couldn't afford it in the first place. So money wasn't there. We're just spending money we don't have. And so it's like, well, I'm going to have to stop making that credit card charge for whatever it was. Well, because you don't have the money now in the near future, going to have to make some difficult decisions. The reality is people will get sicker. Okay? All right? I hear that, and that sucks. But reality is, what are you going to do? You can't just spend money you don't have. Their care goes away, but their needs don't go away. And if anything, they're going to get worse. And so those costs will show up in emergency rooms and 911 calls and other crisis situations, he added. The cost just gets shifted to some other part of the system. That is why so many on the right have said, hey, no issue with immigration. But the U.S. can only take on, about 1 million a year? And you've just brought in about 20 million during the Biden era? So you tell me where's the responsibility lies. You brought in a ton of people who the system couldn't handle, and now you want them funded, and now they're not being funded, they're being defunded, and you're whining about it. Okay, so where does the blame fall? Who's responsible? Yeah. It's not the guys saying, no, we can't afford it. It's not them. That's the hint. It also means lost income for home care workers. All right, well, now you're going down a road of, yeah, but this arguably shouldn't have been employment for them anyway, because we don't have money to fund it. This could force family members who have been caring for their relatives. Okay, so then you go bleeding heart liberal. You know what I mean? What accounts for this? Part of the problem behind the miscalculation of how many would get to keep their long-term care was that people are getting kicked off Medicaid sooner than expected because we don't have money for it. Can't afford it. Budget. Federal officials decided all members of this population will lose their coverage October 1st, not when their annual eligibility determinations come up on a rolling basis. The Federal Centers for Medicare and Medicaid Services informed states of this in the spring, just weeks after the legislative session ended and the state budget was passed. Feds also ruled, contrary to prior rules, people who receive supplemental security income, or SSI, would not automatically be eligible for Medicaid, as they have been. Macri called this decision unprecedented. You've just been handing out taxpayers' dollars like there's no tomorrow. And then everybody's all aghast when and then the gravy train ends. Weird. Unprecedented because we're cutting funds for stuff we don't have money for? Unprecedented. Wow. Truly. Yeah. State officials also underestimated the cost of medical services for the long-term care population. There's a shocker, resulting in funding not robust enough for their acute needs. Of the 1,500 or so people affected, vast majority receive home care services, while about 100 are in facilities like adult family skilled nursing homes. State is prioritizing those in facilities to retain coverage, while almost all in home settings could lose Medicaid, Macri said. How do you prioritize who gets a little amount of resources is always tricky to figure out, she said. And when you've gone down the road of just handing out hundreds of millions of dollars of the taxpayers' money without a real game plan, and you're bringing in millions and millions of illegals into the country, at some point in time, Piper's going to come looking for his due, right? Pied Piper, where is the money? Oh, we don't have it? All right. Well, you guys are hosed because we're cutting those programs. And so a lot of people are going to be impacted. Whose fault is it? Well, I look at, can you afford it? No? Okay. Well, then hard decisions have to be made. And that is the major difference between blue states and red states. Red states are like, all right, fiscal responsibility is important. Blue states are, oh my gosh, it's going to impact people. You don't have money for it. Sorry. Facts don't care about your feelings. They really don't. It's hardcore and it's cutthroat, but it's also reality, right? It's reality. Hey, I know whatever is dying, but we don't have money for it. Therefore, can't fund it. Period. What can be done? Well, union leaders are going to have meetings with the state officials, see if they can find more money. And good luck with that. And this is literally how you end up with a budget that goes from like 30 billion to 85 billion in not very many years at all in Washington state, because we're funding all this crazy stuff, all this stuff that other states don't fund. Big blue state. Macri has called on Governor Bob Ferguson's office and agency leaders to be creative to maintain at least some care. All right, I mean, do what you can. You know, you're going to go on kind of emergency. All right, this is what we're going to do. Also inquired if the state has money available that could be shifted in the near term to cover the costs. Good luck with that. Money is just going everywhere. Ramirez suggested the state could reach out to enrollees to see if they can adjust their immigration status. Okay, I mean, if they could, they probably would, right? Officials have already found 1,500 people who can keep their long-term care services. Their status had changed, but they had notified the state. All right, well, that's a good start, because then, you know, you've got people that are here legit. All right, so in that case, they've gone through the process. They're eligible for whatever. Work requirements that'll likely force tens of thousands more off Medicaid take effect in January. That is going to be interesting. Hey, you can have benefits, but you got to put in a little work. Oh, weird. Separation and elimination of federal subsidies for Affordable Care Health Act through the state's exchange has already resulted in upward of 36,000 enrollees foregoing insurance, because states like Washington hand out money towards coverage. Meanwhile, you've got plenty of residents of the state who don't have their own health coverage, that are paying into the system, that don't have health coverage. Got tons of those. But because we want a virtue signal and say, hey, we really stand by the immigrant community, that's where you get this tug of war. And you've got a real tug of war between the feds and states like Washington, who basically, you know, they just literally can't give up a good cause. They're just so down. They're so into it. And like I was saying, the trans community is coming to Seattle in droves, you know, allegedly. I haven't seen anything to support that there's, you know, thousands of trans individuals moving to Seattle, but it would make sense because they're getting pressure from the federal level, and also states like Texas are saying, no, we're not supporting you. We're not giving you free surgeries to lop off your wiener and balls. We're not doing that. So here's the thing. And then the trans community takes it as if we're being persecuted. We're living under the threat of violence. So we're moving to Seattle. And then people in Seattle are like, we need a declaration of an emergency, because they're overrunning all of our NGOs that support the LGBTQ plus IA community. I might have got that wrong. You got to put the plus at the end. You know, it's up to 8 letters now, third of the alphabet. Yeah. Huh. I say we go for 13. Let's go for 13 and just see if we can get it done. Half the alphabet. All right. So this is kind of the way of the world, and this is one of so many stories where money is being spent that shouldn't be allocated because it was probably never legit in the first place. And on a federal level, we're looking at cutting back on a lot of that because we don't have the money to do it, and didn't have the money to do it when we committed the funds. But under the Biden administration, we were letting in literally millions and millions of criminal illegals per year. And this is some of the after effect. This is some of the impact. Actions have consequences. Hey, you're going to have to cut some of that funding. It's going to suck, especially if you're the one getting the funding. But here's the reality. We don't have money for that. And the red states know it as well. They'd never funded for this. I shouldn't say they never funded. They would fund on a, you look at like Texas, you look at Oklahoma, you look at Florida, how their funding goes. They are not handing out. They're not just making it rain for the immigrant population. They're not doing that. They're not pulling, leering centers to basically fleece the state government like they are in Minneapolis and Minnesota. We're not doing that. So, this isn't along the same lines. This is money to me that is, does have a legit end use. But when it was initially conceived, did we have the resources to cover that? Probably not. Here we are getting cut. Oh my word, what are we going to do? Well, it'll happen one way or the other, right? It always does. And so some people are going to suffer. And that's, budget is a budget. And it's and I don't mean to say that in a harsh way, but when you run a business and you don't have enough money to cover the overhead of the business fails. People suffer. They lose their jobs, right? That's reality. And so because a lot of us live in reality and not some fantasy world where we can just hand out billions and billions of dollars, that's where the rubber hits the road. Reading an article, state of California has somewhere around $437 billion in outstanding bonds, debt, obligations, stuff that they've committed to, haven't started paying out, early pension funding, $437 billion. They have absolutely maxed out their credit cards. State of California. And Washington State, same thing. We've had to put our budget through the roof to cover all this stuff. Because tax and spend, tax and spend, tax and spend. That's what happens in a supermajority that is tax and spend Democrats. We don't have a revenue problem. You got a real spending problem. And what you're seeing right here is part of that. It's part of that. It's part and parcel of that. All right. That's it for me on this one. Thanks so much for joining. Love to have you subscribe, that notification bell. I'll see you in the next episode. Bye for now.